Welcome back to Medicas video podcast, ladies and gentlemen. My name is Varun. I hope you're all doing well. So, we have been discussing about some very important topics related to healthcare and publishing these videos in our YouTube channel. I'm sure a lot of you have been watching, appreciating, liking, and commenting these videos, and it has become a very important educational tutorial for a lot of you who wants to actually maintain a very healthy lifestyle. Today, we have another important topic to discuss with Dr. Kumar Sujeet. He's coming from Wisconsin, United States. He's a very famous nephrologist out there with 14 years of experience. So, this is a very common medical condition we all know about, which is urinary tract infection. So, without wasting any time, let's discuss with Dr. Kumar. Dr. Kumar, namaste, sir. Welcome back to Medica's video podcasts again.
Namaste, Varun. Good to see you.
Thank you, sir. Dr. Kumar, we all know and we have been hearing about urinary tract infections. So it comes in children, it comes in a lot of different kinds of people and everything else. What are some common symptoms of this urinary tract infection, Dr. Kumar?
So yeah, it's important to know, what are the symptoms of urinary tract infection. Typically, you'll have burning in urine. So when you pass urine, you're going to have a lot of burning. On top of that, patients can have fever as well, and occasionally some patients can have small amount of blood in urine. So if you see a combination of all three of them or one of them, you should be suspicious about urinary tract infection. Now,
Oh,
sometimes it's important to know that the kidneys are behind your back, and some patients have infection which travels all the way to the kidney, and those
oh,
patients can have back pain, which is another
okay.
sign of urinary tract infection.
Okay, great. So watch out, ladies and gentlemen, with for these symptoms, but do not come to any conclusions of any medical condition that you may have just by realizing these symptoms. It is important to go to the doctors. They will correlate these symptoms with the tests and then tell you what kind of a medical condition you may be having. So let's not assume things. Let's not believe in the online stuff. Always believe in a registered medical practitioner. Dr. Kumar, we have been hearing that women get a lot of UTIs, but men does not. Is that true or is that false?
So it's actually false.
Okay.
So yeah, but if you divide somebody's life by before 60 and after 60 to 65, and before 65, women have more incidence of urinary tract infection, but after 65, actually men have more urinary tract infection because of a
Okay.
condition called benign prostate hypertrophy, when the prostate gets enlarged. So both men and women can have infection, and depending on the age, actually men can have more infection after 65.
Okay. This is an important observation, ladies and gentlemen. Dr. Sujit, will these UTIs get healed by itself or should we see a doctor?
So absolutely not. If you have a urinary tract infection, you need to be seen by the doctor, and you
Okay.
need a very simple test called a urine analysis, which is like a 5-minute test which can pick up a urinary tract infection quite easily.
Okay. Great. How are these usually treated, sir? Let's say we go to a doctor. How are these UTIs typically treated?
So generally what I like to do, if I see all the symptoms, I start the patients on antibiotics and send the urine test. And if the urine test comes out normal, I can always stop the antibiotic. But generally, the urine test takes 5 to 10 minutes in the office. You know there is an infection going on. You can start antibiotics and test the urine for culture report to see which bacteria is causing the infection.
Okay. Great. So, what happens, Dr. Kumar, if we leave these UTIs untreated?
Okay. So it's very vital that urinary tract infection is treated early and to the fullest. Because number one, as we discussed, the urine infection can travel all the way to the kidney. And occasionally, it can lead to a condition called sepsis, where the infection can actually go into the blood, making you very sick. So,
Okay.
urinary tract infection should be taken seriously and treated early.
Okay, okay. Sir, there is another important question around these UTIs. So, people now are aware of the risks associated with frequent antibiotic intakes. So, what are the risks that are associated with taking antibiotics for UTIs, Dr. Kumar?
So yeah, that's well said. So antibiotics, if you start taking just because you're at home and you think it's UTI, it's not recommended. That will lead to more complication. There is a condition called Clostridium difficile or C. diff colitis, where you lose all the good bacteria in the gut and the bad bacteria take over your intestines, leading to diarrhea and serious side effects. So don't take antibiotics until there is a proof that you have an infection.
Okay, and also, I believe after recommendation from the doctors.
Absolutely.
Okay. So, doctors, UTIs, are there chances of UTIs getting reoccurred, or if you get it once, you will not get it again for the rest of your life?
No, so UTIs are actually prone to recur just because people who have urinary tract infection are generally predisposed to urinary tract infection because of some underlying condition. We discussed that in men over 65, the prostate doesn't let your urine pass through clearly, and that can lead to recurrent or urinary tract infection again and again.
Okay, okay. Sir, let's say if we get these urinary tract infections frequently, are there any ways to prevent it? Like, how do I make sure, or how do anyone make sure that they don't fall under these UTIs frequently?
So yeah, that's a great question, Varun. So it's very important that the urine has to be flowing freely.
Okay.
So it's vital that you drink adequate amount of water if you, especially if you have had a urinary tract infection. The ideal is about 2 to 2.5 liters daily. That will keep the urine flowing and will reduce your chances of urinary tract infection. And sometimes, as we discussed, if there is an underlying condition, then that needs to be treated early and efficiently.
Right. So, doctor, this is another question related to that same question what I just asked you. There are a lot of data, or when I say data, it's not validated data. A lot of information that is circulating around that if you have cranberry juice, the chances of you getting UTIs are very less. How true is that?
So that is a myth. Cranberry juice does not prevent urinary tract infection.
Okay, 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 great. So, are there any home remedies, doctor, or should we definitely go to a medical practitioner if we feel these symptoms and we know that there is a UTI?
Yeah, absolutely. That's a great question. So there are no home remedies to treat urinary tract infection. And it's again very vital, especially if you have diabetes on an underlying condition which can predispose you to a severe infection. It's very vital that you test a urine for infection and treat it early. And that gives you a good cure. Treatment as little as 3 days of antibiotics can cure the urinary tract infection and can make you feel much better.
Okay, okay, great. So this is again a very important question, especially for pregnant women. So if a pregnant woman, and they suspect that they have a UTI, should they be concerned? What should they do?
Okay. So that is actually a vital, important question, Varun. So urinary tract infection in pregnancy is treated very differently than normal people. So in pregnant patients, you don't need symptoms to start treatment. In fact, just the presence of a little bit of bacteria in pregnancy needs to be treated early without even having full urine test showing urinary tract infection. So it's very vital that if there is a presence of bacteria during pregnancy, even if you don't have a full blown UTI, that needs to be treated because that can lead, untreated UTI can lead to early delivery or early labor and other complications.
Great, wonderful. Thank you. So these are some of the, common questions, some of the questions that are asked by public. Some of them I felt I wanted to ask you because UTI has been prevalent. A lot of people have been having these UTIs. A lot of information which is available online, which is correct and incorrect, incorrect practices, myths that you have busted, Dr. Kumar. Ladies and gentlemen, I believe this session has been useful to you, especially with regards to urinary tract infection. This is directly from a nephrologist from United States of America who's got 14 years of experience handling all these kinds of common medical conditions. If you would like to talk to him personally and understand about your kidney health or your kidney related stuff, you can log on to www.medicasapp.com. Download Medicas app from Play Store or App Store, and you can find Dr. Kumar there and you can talk to him. You'll also find a lot of other health related tutorials, health related articles, and other doctors that are available on the platform also. Dr. Kumar, it has been wonderful talking to you again, sir. Until next time, we will wait to hear back from you for your next availability. And then we will connect for another important topic, Dr. Kumar. Until then, thank you, sir. Namaste.
Thank you, Varun. It's been a pleasure.
Pleasure is all ours, sir. Thank you.
Thank you.